Hey everybody, it's Diandra Marie, and this is Power, a mini-series I created for Women's History Month. I interview 4 exceptional women who are making strides in their industry. They give their perspectives on working in male-dominated fields and drop some gems along the way. Kanye was right. No one man should have all that power, because we hold our own too. So stay tuned for today's episode of Power on itsdiandramarie.com.
No one man should have all that power.
To my right, I have Dr. Htadra Jameison, who is a clinical psychologist working at a state prison. And you also might have seen her on my 5 quick tips video. You know, she helped the sister out with that. So how are you today?
I'm good. How are you?
I'm good. So being a clinical psychologist in a prison, like what type of work do you do? What does that entail?
So I actually work specifically with a certain population. The therapy and treatment is catered to helping them sort of rehabilitate and be entered back into society essentially and into the community. So the therapy that we do is very intensive. It's challenging, you know, because I sit there across from these men who have done some pretty horrendous things.
Okay.
And me being a young Black woman, sometimes I run into challenges where there might be some racial difficulties and then a gender difficulty, because what grown man wants a woman psychologist sitting in front of them? When you're in prison for a long time, it's really hard to reintegrate back into the community.
That's true.
So our work in terms of rehabilitation and making sure that they don't recidivate or, harm any more people is, with hopes that they'll be successful.
So you mentioned, dealing with some sort of sometimes barriers with your patients, let's say. And I actually read a study that 41% of female doctors do hear offensive remarks about their gender from their patients, as opposed to the 6% of male doctors who hear those offensive remarks based on their gender. How do you respond to stuff like that?
That's been a challenge for me since my start of doctoral school and going through training. I've always sort of gotten that look, like that side eye of like, you're my doctor.
Okay.
And I mean, I've heard it, not even just a look, but I've heard it like, you're the doctor? And I'm just like, yes, I'm the doctor. And they're like, how old are you?
Wow.
And, then I get into the whole age thing. Here at the prison, and I feel it way more in this population than I've felt in any other setting that I've been in. And again, it's because we're working with grown men, who have very difficult personality disorders. Their sort of framework has always been this dislike and hatred towards women. So walking into a room, it's kind of like, you have your mommy issues sitting in front of you, and it's like, well, you remind me of my mother, and I don't like women. I've always had a problem with women, and it's a challenge. Hopefully we can reconstruct that framework that you previously had and reconstruct it into a new and more healthy framework of women.
Right, just based on their experiences with you.
Exactly.
That's really dope. Let's switch gears just a little bit. I mean, who cares about the haters? Really. No, seriously, I think being a doctor is just such a huge accomplishment. I mean, just outside of the amount of years you have to spend in school, it's just the drive that you need to finish school. It's one thing to go to 4-year and get your master's. It's another thing to, write a dissertation and then do a residency, because it don't just stop at the schoolwork. It don't just stop at the schoolwork. So what is that like for you, just to be able to add that doctor to the front of your name?
For me, it was a goal that I set out for myself a long time ago, and to see that through was an accomplishment in and of itself. Sometimes I forget that I'm a doctor.
How?
Like, I don't know. I do. Like, not that I forget, it's like an out of sight, out of mind type of thing, because I'm in it every day.
Right.
But I don't let the doctor define me. When I sit back and reflect, it's just like, wow, I really did do that. Like, I really did go through all of that and kept my mind focused, and I took no time off and went straight through. And
trust me, she did.
At 29, it was like, oh, here I am. Like, I'm really a doctor.
Name a woman in history, dead or alive, that inspires you or has inspired you in the past.
I really look at my role models as people around me,
Right.
like in my everyday life, which happens to be my older sister. And she really just set the bar for me.
Nice.
So she's a doctor as well. And it was just like, okay, like if she can do it, like she's lit. Like, absolutely I can do it. And I think that it makes it even more real to have somebody in your own
circle.
reality. You know what I mean?
Yeah.
To like look towards, because it's like you can touch them, like
Right.
you can like
Ask them
get
questions.
advice, right?
Yeah.
Ask them questions, and they can help to motivate you. So for me, I think that's been my biggest motivation. But when Michelle Obama came on the scene, I was like, honey, she is gold.
For real. She's like
All
a
the way.
continuous goal.
A continuous gold.
Like,
Continuous.
Word. No, I get you. Well, I just want to thank you for sitting down with me, and just discussing what you do and discussing how your interactions with people, being a woman in such a male-dominated industry, definitely. Check out Dr. Htadra Jameison at your local state prison. No, I'm kidding.
Don't come to prison and see me, okay? See me in private practice. I got you.
I'm hoping you can inspire other young women who,
I hope so.
Yeah, who are thinking about being a doctor or maybe not sure or going through that phase of, can I do this? And it's like, yes, you can. It's Diandra Marie and Htadra Jameison, Dr. Htadra Jameison.
Dr. Htadra Jamieson.
And we're out.